Are you a senior who suffers from hip pain? I know my mother had bad hip pain in her later years, and it was awful. I felt so bad for her because it just makes it difficult to get around. So I'm here today with some methods that you can use to help ease your hip pain so hopefully you can get on with your life and not have that experience anymore. Hi, it's Robin with SeniorSafetyAdvice.com. Tune into our channel for tips and hints for seniors and caregivers about aging in place safely. So, WebMD actually says that about 50% of older adults suffer from hip and also knee pain. So, it's a very common thing. But how do you alleviate it? Well, the first thing, and I'm sure you're already doing this, is if you're walking around and you have hip pain, you want to get off of your hip. So, resting it, because that's going to help to decrease the inflammation around the joint. If it's a muscle pain, then that's going to help to rest that muscle and give it a chance to heal. The next thing to do, of course, too, and you're probably already doing that, is to take an over the counter pain reliever. Things like acetaminophen and ibuprofen, those also help to reduce swelling, which will in turn help to decrease the hip pain. The next thing, number three, is to use either heat or ice on the hip. What really helps a lot is to use them not concurrent, I guess it's concurrently, is to use them one after the other. So, for example, you'll get a heating pad, you'll put the heat on your hip, and then after 10 or 15 minutes, you'll take that off and then you'll put ice on your hip. So, you want to be sure with both of those that you have something in between your skin and your heating pad or your ice. You don't want to put those things on bare skin. But you do want to make sure that it's warm enough that, or thin enough that the heat will penetrate or the cold will penetrate. The next thing, if you're having continued hip pain, is to use something to help support you when you're walking. So you can use a cane or a walker. Maybe you are a hiker and you have a walking stick. Anything like that that can support and make sure or help to take the weight off of that side will help that joint to recover a little bit more or help the muscles to recover a little bit more. Now, I do want to point out that if you're frequently having hip pain, then you really want to talk to your doctor about that. The methods I just gave you, those are something that will help if it's an acute thing where it's a flare up that just happened, maybe you stepped funny and it pulled the muscle a little bit. Those are going to be helped. Those types of things are going to be helped by what I've just said. But if it's something that flares up a lot, you really want to address it with your doctor, because there's other things that can be done for a more chronic type of a situation. The first thing that they may talk to you about is doing exercises for the hip. Now, this sounds really counterintuitive, because if you're walking around on it and it hurts, why would you add to that by doing exercise? But I know for me, if I sit too long, I get more immobile, so to speak. Things takes me a couple of steps to get everything going again. So by doing a low impact exercise like cycling or swimming, not anything high impact, don't go out jogging, but low impact keeps those muscles moving. It strengthens those muscles, which will help to support the joint more. Another thing to try if you're having more frequent hip pain is acupuncture. So, acupuncture, I know you've heard of it. It's a very ancient method of healing where they put the little needles into the skin. The idea behind that is that the electrical current between the muscles has been interrupted. And so that's why you're having pain. And by putting those needles in, it helps to reestablish that electrical current. I know it sounds like a little woo-woo, but it really does work. I have a neighbor who injured himself a couple of weeks ago playing volleyball, and he was walking around, I mean, for a couple of weeks with a cane. They really kind of thought maybe they were going to have to do injections or surgery. He ended up going to the acupuncturist, and within just that first session, he walked out of there without his cane. So, I mean, it had been that bad that it took away that pain for in that short a time. Now, that wasn't the only treatment that he had, because it didn't last but a couple of days. But it's kind of like a chiropractic thing where you have to go back several times to get it to hold, so to speak. Acupuncture is the same way. So he's now had several appointments. I mean, he's doing really well. They took a day trip the other day and he spent most of the day walking around, no cane whatsoever, and did really well. And again, he couldn't hobble around hardly at all with his cane before the acupuncture. So, a holistic method to give a try. And keep in mind, too, doing something like that takes away some of those side effects that you would experience if you had prescription medications. So, the next thing in your arsenal, if you have more chronic hip pain, is to make sure you talk to your doctor, as I said, but is to have the doctor maybe refer you for some physical therapy. Sometimes you can do certain stretches and certain specific exercises that home in on that particular joint, and a physical therapist will know which ones would benefit you. They can work with you while you're there and make sure that you're doing them correctly. And then you do those exercises at home as well, and that can help again to strengthen the muscles around the joint to support the joint better. Now, we talked before briefly about injections. That would be next on the list if you have the chronic pain and you're having some problems, is to talk to the doctor about corticosteroid injections, cortisone, that kind of thing. That would be further down the list. That would be something you'd really do if it was chronic pain, because you can only do those type of injections so often, but they can be beneficial for you to help in the short term to alleviate your hip pain. Obviously, if you've gone through all these things that we've talked about and you think that maybe you need to lose a few pounds, I mean, can't all of us? We all think we need to lose a few pounds, but sometimes that can help too. So if you've been thinking maybe it would be good for you to do, taking some weight off of your body can also help with the joints. Now, I'll tell you, this is more of an extreme example, but I had a patient who had the stomach reducing surgery. Before the surgery, he had had so much trouble with his knees. He had a little dog and he could barely take the dog out for the walk, the daily walk that dogs need several times a day. He lost more than 100 pounds. I think it was something like 130 pounds. And by the time he'd lost all that weight, he was taking miles long walks with that dog. And all he had changed was losing the weight. So again, it's not the same thing to lose 130 pounds as it would be to lose 10 pounds. But it is something that you could try to see if that doesn't help a little bit with your joint pain as well. Just losing, a little bit of weight. Lifestyle modification. Anyway, if you have gotten through all of these things and nothing is really helping your hip pain, then as a last resort, it is time to consider surgery. Again, that's something to discuss with your doctor because all little things affect each other within your body. So you may be having hip pain, but it may be that you need to have a knee replacement and you're standing funny on your hip. And, so that's why it is good to go through at the very last resort, go through this with your doctor and the specialist that he or she would recommend and investigate it to be sure that your hip pain really is hip from your hip. So now, speaking of that, how do you know whether it's muscle pain or it's joint pain? Well, if it is muscle pain, that's usually more when you're upright walking around and you've been on it for a while. If you're resting and it feels better, then that generally tends to be muscle pain. If the pain is something that comes when you have been resting, so, my mother used to, as I said, had a lot of hip pain. She would have the problem mostly in the morning when she would wake up. Her hips would be so sore from sleeping. She had not been moving around and those joints had kind of frozen up in the middle of the night. And so that is a way to tell more that it is a joint pain. Either way, you do need, if it's something chronic like that, you really do need to talk with your doctor. It's better not to guess. Make sure you go right to the person who knows what they're talking about, and that way you're getting the most effective treatment. So I hope these tips will help you with your hip pain. If you like the video, please give us a thumbs up. That helps to keep the video higher in YouTube's algorithm so that more people see it and more people can get the benefit of it. And also, please subscribe to our channel. It's down, the button is down in the corner down there. And that way, if you subscribe, you won't miss any of our informative videos. So again, I wish you good luck with your hip pain, and I hope that these tips have helped you. Thank you so much for watching. Until the next video, take care. Bye.